Okay, today we are going to discuss the care of the dental prosthesis. So as you can see up here, that's dentures, it can be partials, it can be a whole number of things, and we'll kind of get into all of that. So let's see it from the patient's perspective, which you can see here, this patient does not have any teeth. So their maxillary and mandibular teeth have been removed, and this is what a mouth with no teeth will look like. So there's different types of prosthesis. So there's fixed, there's removable, so partial or full. There's an overdenture with implants or with naturally retained teeth. And then there's the obturator. So that's to close a congenital opening in the palate usually. So that's to stop any liquids or anything going up into the nose. So it closes off that hole there. So this here is just kind of a picture of different devices. So we have our partial. You can see these are metal clasps here that are going to click into the teeth, and it's going to hold that partial in place. Over here, this is a 3-unit bridge. The teeth on the side, these are called the abutments, and that fake tooth in the middle is called the pontic. We want to stress to our patients with bridges the importance of cleaning underneath, and we'll get into that more. But basically, we want to make sure that they're getting floss underneath it. You really want to focus on the mesial and distal portions of these abutments so that those teeth are not decayed. So what happens is if this patient ends up with a decay on their abutment teeth, they're going to lose probably this entire bridge. So we want to keep that area nice and clean, and we'll get into how they do that. On the bottom, we have your full upper and lower denture, and that is going to replace when all teeth have been extracted. So this is our bridge. So this was, like I said, these are the abutments, the pontics, and then you will see in the mouth here, this is pointing right to that pontic. It actually looks like there's probably 2 here, and then it's retained to this tooth here and probably this tooth right here. So what you would do is you would teach the patient how to get a floss threader underneath there to clean that surface. They want to make sure they're getting that food out so that one, this tissue looks good, and they're able to make sure that they can keep this bridge for a long time. Looking in this mouth, it also looks like they have a 3-unit bridge up in this area as well, and that you can kind of just see the difference in the color. This would look like it would be the pontic. So partial removable denture. This is a metal one. I can't say patients love them, but they do what they're supposed to, and they have these nice clasps that hook onto the teeth. And usually you can get a nice snug fit with them. Sometimes you'll see your doctor tighten them. If it's getting too loose, they can tighten these clasps and make it fit better, but it hooks right onto teeth that they have in the mouth. So that's just when they're missing a few different teeth, but all their other teeth are sound and there's no sense in taking them out. So they would have just a partial removable denture. And here's the full denture, maxillary and mandibular, that they would use to replace all of their teeth. So maxillary anterior dentures, you can tell that this is maxillary because this is the part that would go over the palate. We want to make sure that we're telling our patients how important it is to take their dentures out at night. We want to allow that tissue to breathe. And we say the word breathe, and obviously, they don't have lungs, but we want that tissue to be able to be cleansed with our saliva, to not have this device sitting on top of it at all times. They're very at risk for fungal infections underneath or sores, or they can be uncomfortable. So we really want to make sure that they're taking them out at night. You will find some patients, they don't even want to take them out when they see you. They're very self-conscious. They don't want anybody to see them without their teeth. They may sleep in their dentures. They may have people in their lives that don't even know that they wear dentures. Those people, I tell them, even if while you're showering and getting ready for the day, take them out and soak them then. At least give the tissue as much as you can without them in, that you're comfortable with. Overdenture. So overdentures are great. So you can tell this is a mandibular denture. Mandibular dentures are much harder to get a good tight fit to. excuse me, they tend to slip. We don't get that same suction that we get from the palate of the maxilla. And they tend to float. So once we start to lose this alveolar bone on the bottom here, these tend to rock. They can slip while the patient's eating. That's why these implant retained dentures are really great. So the implants go in, and then there's clasps on the bottom of the denture, and it snaps right in. Much better fit. Patients are much happier with it. They tend to wear it more often. It's a great option. These are just different types of clasps that you may see. And just to kind of keep in mind too, when we're eating and chewing and pounding on our teeth the way that they're meant to be, that keeps the bone in our mouth stable. Once we take out those teeth and we don't have that pressure of chewing, the bone, what's called resorbs. So we lose that bone. As we lose that bone, that's why that denture has such a much harder time staying in place. Just different types of clasps. You'll still see these patients regularly for checkups at least once a year. They'll come in, they'll take the denture off, you'll clean around the implants, you'll do your exams just to make sure that everything is looking the way that it is, that it's comfortable for the patient. Because if it's not, you really want to encourage them to have the denture looked at, have it relined if it needs to be. They're making a very big investment in their mouth with dentures. We just want to make sure that they're getting the use out of them. So immediate dentures. So these are some teeth that we can tell are going to be taken out. So here is that picture that's sewed up, but see how puffy this tissue is? The patient will leave with what's called an immediate denture. It'll go over the sutures and over the inflammation so that they're leaving with teeth. However, as the inflammation heals and comes down, that denture isn't going to fit right. And that's when it needs to be relined, which the doctor does to get it to fit better, because you want it to fit once all the inflammation is down, because it's not going to fit the same way. And then that's what the immediate denture looks like that they'll go home with. See pink tissue, or what looks to be pink tissue. Now this is called a cusial or cusial denture. So this one is retained. These holes right here in the denture, that snaps right on over the teeth that you already have. So that'll slip right in. The patient has most of their teeth removed except for those two, but it'll fit right over there, and that way they can hang on to their own teeth that they have left. So that's what it looks like. It snaps right on, and you can see this here is their regular tooth, or their normal retained tooth. Valplast partial. So a Valplast partial is a favorite of patients. It's not metal. You can't see the metal from pictures or anything like that. It's pink, and they tend to love them. They're comfortable, like I said. However, they have some downfalls. So they're not fixable. So if you break your denture or if it's not fitting, it can't be relined. So this is kind of a one size fit. And then if it's no longer fitting, it needs to be replaced. Sometimes it may drop or break if they drop it. Again, it can't be repaired. These are just Valplast versus acrylic. So these are Valplast. You can see the metal clasps here and no metal clasps. You might see something like this in a teenager too, who's congenitally missing their laterals or saving space for implants at some time. You might see a patient that has something like this. This sometimes is only meant for temporary, but they have it for years and they love it. The other thing to keep in mind too is dogs love these things. So even your full denture, you always want to make sure that you keep it away from anywhere that your dog can get it. I can't even tell you how many times I've had patients with retainers or anything like that their dog has chewed, me being one of them. But dogs love these things. So you can see the difference. So you can see how the clasps are shown here, and the Valplast down here, it just looks more like their tissue. You can't see those metal clasps. And sometimes these might make patients self-conscious, especially if they're younger. They might not want to have that showing, and they may opt for the Valplast. So here it is again in place. You can see the outline. It really tries to match the tissue and it just snaps right in there. Again, this needs to come out at night as well. It needs to be cleaned, needs to be in water, but you can barely see it. Again, that's it in place, right? Hard to even tell which one it is. So then we have other oral appliances. We have our athletic mouth protectors, so your sports guards, bleaching trays if patients are doing at-home bleaching, custom fluoride trays for patients that are more susceptible to caries. We have our night guards for those that are clenchers and grinders. Oral habit appliances, think kids that are sucking their thumbs or their fingers, and then ortho appliances and retainers. Again, dogs love these. Think, encourage your patients too with the athletic mouth protectors. They want to be cleaning them. You don't want to just stick it in that case and then open it up again for sports. It's going to smell and who knows what could happen. So needs to be cleaned. They have tabs that you can soak them in, but definitely needs to be cleaned. So self-care for both denture and oral tissues. So they, like I was just saying, they have to take care of their denture. You don't want hardened biofilm on it. That can be irritating. If it's not getting cleaned, that can lead to those yeast and fungal infections, candidiasis and thrust. That's the number one infection. And again, if you're not cleaning it, it can smell. It can change color if it's not kept in water. There's so many different things. So teaching the self-care of their appliances is just as important as teaching them self-care of their own teeth. Regular exams, so at least once a year, come in for a regular exam. They may need to have their dentures relined. Eventually, they may want to have them replaced. Some people can keep them for years and years and years, and they don't mind. Other people might opt to have new ones made, or sometimes patients just like to have an extra set in case something goes missing, but they like to have a second set. And again, the relining, so keep in mind that alveolar bone is always going to change. And that patient might come in, and if it's not fitting right, you might notice they have a sore in their mouth, or they might say it's uncomfortable, and they might just think that that's how it's always going to be. So we want to encourage them to see the doctor, have it looked at, have it adjusted so that they are eating comfortably. So how old do you think this patient is? So you can see this is called loss of vertical dimension. So our teeth are space holders, right? So they kind of hold up our lips, they hold up the shape of our mouth, and we tend to get these frowny lines when all of our teeth have been removed. They're called like marionette lines. If you think of those like puppets on a string, that's what they're called. So you almost like this sagging appearance. It looks a little aging. So here's somebody else. Obviously, you can tell they have their teeth. They have a normal smile shape. And it looks like, their lips are fuller. And you can tell this person here is 53 compared to this person that's 48. So the lips tend to collapse. They're no longer holding the space. And then you get that sagging appearance. You can see a person with their teeth. They have nice thick bone down here, and all the teeth are in place, as opposed to somebody who does not, and there is no longer any supporting bone there. Here's just kind of a diagram of the skull, teeth versus no teeth, and see how much bone is lost. This is just a picture of intraorally showing that collapse of that alveolar ridge. So this is the bone that you start to lose once all of your teeth have been removed. Here's another picture on the other side, kind of showing the same thing. But you can see this is why it would be very hard to get a denture to fit in here, because really, what is it snapping onto? You're going to have to use a lot of paste. That's why those implants are a great way to have this be able to stay in comfortably. Cleaning, so different methods of cleaning, right? So we want to rinse under water, denture brushes to clean. They have your own kind of ultrasonic cleaner that you can have at home. These tabs are great. Soak your denture in overnight with tabs, brush it in the morning. Some patients might opt to use this little cleaner. Same with retainers as well. So brushing, denture brushes, like I just said. Remember, it's very susceptible to breaking when you are SEM, you're going to learn how to take care of oral appliances and our protocol here at Middlesex. But you do want to kind of line the sink with paper towels. In the event that you drop it, it has kind of a cushion there. Here are some different brushes, denture brushes, that you would use to kind of really clean in all those different spaces there. And when the patients come in, you want to check their denture as well. We're going to clean them whether it's at school or in the office, and make sure, check it for anything that's broken. And again, always verify that it's comfortable for the patient. So here's just a kind of a visual of cleaning the denture. This is the clasp here that it would hook onto the tooth. This little brush is great for cleaning around those clasps. This is called an end tuft brush. So this tooth in the back here, they probably were a partial. The partial probably snaps on back here. But what happens is the patients tend to focus on teeth that are next to each other when brushing. So this guy in the back, this gold crown, kind of gets forgotten about. And that's when I love to recommend an end tuft. It gives them a reason to hone in on that one specific tooth. So I give them the end tuft. I show them how to use it. And I say, after you're done brushing, just take this small little brush and brush around that last tooth there, because you'll tend to find a lot of plaque that's left behind by the patient. So we also want to make sure we're taking care of the underlining mucosa. So we're going to brush, rinse it. You can use those little sponge brushes and just clean it. You can massage it, digitally, or a soft one of those little sponge brushes. But we want to make sure that we're taking care of the tissue as well. And that's another thing we have to show the patient how to do. Here are our floss threaders, which we mentioned at the beginning. This is what's going to help you take care of your bridge. This slides in, and then the floss then scoops underneath the pontic. So again, cleaning your fixed prosthetics. This actually looks like it might be super floss. So super floss is more of like a tufted floss. It has a plastic piece on the end. And again, you would scoop that in and scoop under. Ask the patient how they're taking care of it at home. Make sure that they're flossing, that they know how to get underneath and clean it. Some patients might opt for a water pick, but just make sure that they're getting something underneath there, because you don't want to end up with decay on the teeth that support the bridge. So denture and disease. So we still have to, just make sure that they are understanding oral hygiene, what could happen if they don't remove, xerostomia due to medications, the fit of, and the denture might lead to some of these xerostomies. So just a lot of things we still want to make sure that we go over with our patients, and understand that just because they don't have any teeth, they still have to put in some time to care for their mouth. So this is denture hypoplasia. So this is a reactive lesion from the pressure that the denture forces if they're not taking it out. So think 24 hours a day, the gingiva here starts to overgrow. So that's gingiva hypoplasia, and that's due from the forces that are there 24 hours a day cause that tissue to grow like that. Then we have papillary hypoplasia. So this is really common. I guarantee you'll see this quite a bit. This is also just from constantly wearing your denture and not taking it out. You end up with this hypoplasia there. So denture ulcer. So a new denture wearer. So think of, you just got yourself a new pair of shoes. I know this just happened to me. I got these great new shoes, and I ended up with blisters on my pinky toes. And it was that ill-fitting new shoe. So this can happen for a new denture wearer. They might end up with a lesion, and sometimes it just means that the denture needs to be adjusted. It's not fitting right. The occlusion isn't right. Again, it's a lot of trial and error at the beginning. So the doctor's going to have them come in. They're going to check for these ulcers, just to make sure they get the right fit. And again, it doesn't always happen at once at the beginning. So candidiasis, so see all these red patches here. That's from candidiasis, from wearing the denture 24 hours a day. Your tongue, we don't realize, but our tongue does clean our palate. The saliva is cleaning the palate. So when the denture is being worn 24 hours a day, you're not getting that natural cleansing. So angular cheilitis, again, no more vertical dimension, and you may get these little lines with these patches there because bacteria loves warm and wet places in the corner of the mouth. Can also be caused by vitamin D deficiency, and it's more common in females, and it's caused by that C. albicans. So prevention. Um, Again, keeping teeth intact, diet and nutrition. Vitamin D is a big one. Relief from xerostomia. Caries control for overdentures. That's again the teeth that it clasps onto. We want to try to keep those teeth intact. That is all.